So this patient is complaining of congestion. So we are going to adjust her first thoracic vertebrae right here, breathing difficulty. So come on over here. Let's consult the Merrick chart. This is T1. The first thoracic vertebrae, look at the effects. So when this vertebrae goes out, asthma, cough, difficulty breathing, shortness of breath, and pain in the upper extremity. So we're going to come back over to the patient. We're going to adjust her first thoracic vertebrae. She's going to take a deep breath in, all the way out, and relax in a nice impulse. Awesome. How was it?
That was super great.
Great.